everyone, welcome back to my channel. Today I am going to discuss about tuberculosis. So let's start our today's topic. Tuberculosis is the world's second most common cause of death from infectious disease after HIV or AIDS. Tuberculosis is a chronic lung disease. It is caused by Mycobacterium tuberculosis. It is spread by inhaling tiny droplets of saliva from the cough or sneeze of an infected person. Definition of tuberculosis. Tuberculosis is the infectious disease primarily affecting lung parenchyma, is most often caused by Mycobacterium tuberculosis. It may spread to any part of the body, including meninges, kidney, bones, and lymph nodes. Next, types of TB. Mainly there are four types. First is pulmonary tuberculosis. Pulmonary tuberculosis is caused by Mycobacterium tuberculosis. It mainly affects the lungs but spread to the other organs of the body. Second is avian tuberculosis. Avian tuberculosis is caused by Mycobacterium avium that can affect a wider range of bird. Next is bovine tuberculosis. Bovine tuberculosis, it is an infectious disease of cattle and it is caused by Mycobacterium bovis. And last is miliary tuberculosis. Miliary tuberculosis is a potentially fatal form of the disseminated disease due to the hematogenous spread of tuberculi bacilli to the lungs and the other organs. Next comes to the risk factors of TB. First is close contact with someone who have active TB. Second is immunocompromised status. Next, drug abuse and alcoholism. People lacking adequate health care means people who are not maintained their hygiene, they will be infected with TB. Next, pre-existing medical conditions like diabetes mellitus, chronic renal failure. Next, immigrants from countries with higher incidence of TB. Institutionalization, living in substandard condition, occupation. Next comes to the clinical manifestation, means signs and symptoms of TB. Constitutional symptoms, anorexia. Anorexia means lack or loss of appetite. Second is low grade fever, night sweat, fatigue means weakness, weight loss. Next, pulmonary symptoms. Pulmonary symptoms includes dyspnea. Dyspnea means difficulty in breathing. Next, non-resolving bronchopneumonia, chest tightness, non-productive cough, mucopurulent sputum with hemoptysis. Hemoptysis means coughing up of blood. Chest pain. Extrapulmonary symptoms includes pain and inflammation. So these are signs and symptoms of tuberculosis. Next comes to the assessment and diagnosis. First is history collection, means we should collect the history of the patient, including her family members. Next, physical examination, clubbing of the fingers or toes in people with advanced disease. Swollen or tender lymph nodes in the neck or other areas. Fluid around a lung. Unusual breath sounds. If miliary TB, then physical examination may show swollen liver, swollen lymph nodes, and swollen spleen. Next, test may include biopsy of the affected tissue, means lung biopsy, bronchoscopy. Bronchoscopy is a procedure that uses a bronchoscope to examine the inside of the trachea, bronchi, and lungs. Chest CT scan, chest X-ray, interferon gamma release blood test, gold test to test for TB infection. Next, sputum examination and culture. Thoracentesis. Thoracentesis is a procedure to remove fluid or air from around the lungs. Next, tuberculin skin test. Next comes to the complications of TB. In bones, spinal pain and joint destruction may result from TB that infect your bones. Next, brain. It is affect mainly meningitis. Liver or kidney. heart, pleural effusion, TB pneumonia, serious reaction to drug therapy. So these are the complications of tuberculosis. Next comes to the prevention of TB. First is isolation. Isolation means apart from all human beings. So who have suffering from active TB, they will stay in isolation room. Next, ventilate the room. The room should be ventilated. Cover the mouth. Always wear mask. Finish entire course of the medicine and vaccines. Next comes to the medical management of TB. Pulmonary TB is treated primarily with anti-tuberculosis agent for 6 to 12 months. First line anti-tubercular medications includes streptomycin, isoniazid, rifampicin, pyrazinamide and ethambutol. So these are the first line drug of TB. Next comes to the second line drug of TB. Capreomycin, ethionamide, para-aminosalicylate sodium, cycloserine and vitamin B. So these are the second line drugs of TB. Next comes to the DOTS in TB. DOTS means directly observed treatment. This name is given to the World Health Organization recommended tuberculosis control strategy that combines 5 components. First is government commitment. Includes both political will all at levels and stabilizing a centralized and prioritized symptoms of TB monitoring, recording and training. Second is case detection by sputum smear microscopy. Third is standardized treatment regimen directly observed by a healthcare worker or community health worker for at least the first 2 months. Fourth is a regular drug supply. And fifth is a standardized recording and reporting system that allows assessment of treatment results. At last, we will discuss with nursing management in TB. First is assess the condition of the patient, then obtain history of exposure to TB, assess for signs and symptoms of active disease, auscultate lungs for crackles, and during drug therapy assess for liver function. So this is all about tuberculosis.